Okay, I'm asking for a name. Who is in charge of making sure that people who need to get tested, who are indicated to be tested, can get a test? Who?
The scramble for answers, outrage at the government response to the deadly coronavirus pandemic.
The system is not really geared to what we need right now, what you are asking for. That is a failing.
And a failing, yes.
It is a failing. I mean, let's admit it.
Worldwide, cases of COVID-19 shooting past 125,000. In the U.S., more than 1,600 cases and at least 40 deaths. Efforts to contain the outbreak here sparking confusion and cancellations.
End of a fabulous tournament.
The nation now in the midst of a new kind of March Madness. The NCAA shocking basketball fans no tournaments, no championships this year. The NBA suspending the rest of the season. Professional baseball, hockey, soccer, all postponed until further notice. New York's famous Broadway, silenced. Forget long lines at movie theaters. Some of the hottest new film releases, delayed. The cascade of closures includes Disneyland and Disney World, which entertain tens of millions each year. In Washington's halls of power, the same sign, closed, closed, closed. The chaos propelled Wall Street into its worst day in more than 30 years.
With those closures, we know there's going to be a dramatic impact. We're not sure yet exactly what that number is going to look like, but it's clear it's going to be significant, and it's very clear that it will mean, at least for this point in time, a contraction in the economy.
Governors taking drastic steps to stop the spread of the virus.
To reduce the number of people in contagious environment, no gathering with 500 people or more.
And closing school districts will help slow the transmission of this dangerous virus.
We do have in this executive order the ability to commandeer existing private sector assets, including hotels and motels.
At the White House, President Trump defending his decision to ban foreign travelers from huge sections of Europe.
If I need to do something, I'll do it. I have the right to do a lot of things that people don't even know about.
The new rules limit travel from 26 countries with the exception of the UK.
It's a world problem, and you do need separation in some cases. You have some areas that are very heavily infected, and you have some areas that aren't, frankly, but we do need separation for a little period of time in some cases.
But there were questions on exactly what the president had proposed.
The president is not providing clarity. He seems confused about his own policy. He misstated his own travel ban. The critics say that travel ban now is like locking your door after the killer's inside the house, but there are some who say it works. But he doesn't even seem to manage to articulate it in a speech to the nation clearly. The other thing the president is doing right now, from the beginning, President Trump has attacked this problem with a lot of happy talk. Stay calm and it will go away, he said.
The president also facing questions about whether he should be tested for COVID-19. Last week, he was socializing with a delegation from Brazil at Mar-a-Lago. One of the Brazilians seen here in that hat standing to his left has now tested positive for the virus. Across the country, hospitals are gearing up for influxes of patients. Surge tents popping up around Boston, San Jose, and Salt Lake City.
I believe once testing becomes more widespread and available, we might see a surge in patients.
Dr. Alan Kaplan is head of emergency services at Plainview Hospital in Long Island, New York, where they're already seeing COVID-19 patients. He gave us a behind-the-scenes look at his hospital's overflow zone, equipped with all the necessary medical tools.
We have equipment to monitor patients' vital signs, and we have ventilators if needed in patients in severe distress.
Nurses like Stephen Jones are on the front lines.
We go towards the disease while others run for the hills from it. I would say at least 10 patients came in today with at least had mentioned the word coronavirus based on their symptoms.
Plainview Hospital is part of Northwell Health, which is now allowed to run its own tests. Jones demonstrated exactly how that's done with the help of a hospital employee.
This test entails 2 different swabs. I'm going to hold it back of your head just like this.
The test is similar to a regular flu test. Once he swabs the patient's nostrils and throat, he then sends them off to a lab. Results come back in 24 to 48 hours. That will get faster in the next couple of weeks.
If they're not sick, sick enough to be admitted to the hospital, we will send them home and give them instructions on how to self-quarantine and take care of themselves. The only people that should be coming to emergency rooms are those who are in respiratory distress, having trouble breathing. You can say 80 to 90% of the people having this disease will be well managed, just staying home, and it will resolve on its own.
We treat these patients as if they are our family members, and that it's game time, that we just, we get focused and we are ready to go.
Today, in the New York suburb of New Rochelle, the National Guard flooded into the nation's first containment zone, site of the largest cluster of cases.
Some of the people who live here call it the epicenter of the epicenter. Just behind me is where the National Guard has been activated. They're handing out meals today. And if you're at home and you're wondering why are they handing out meals, well, it's because some schools have been canceled here, and kids who go to school rely on meals, including breakfast and lunches. Also, a lot of families out here are trying to figure out how to go to work and also deal with children who no longer have school. There is a lot of uncertainty right now, and health officials and the government here, the state government in New York, want to make sure people don't go hungry.
I was just helping everybody out, making sure everybody get what they need, and keep moving, keep everybody happy, satisfied.
People here are told not to gather in large groups. That pattern is being replicated nationwide, meaning it's game over for many sports.
The game tonight has been postponed. You're all safe.
An NBA game abruptly canceled last night after two Utah Jazz players, Donovan Mitchell and Rudy Gobert, tested positive for the virus. Earlier this week, Gobert poked fun at all the talk about coronavirus and ended a news conference by pointedly touching tape recorders and microphones. Today, he's apologizing on Instagram, saying, "At the time, I had no idea I was even infected. I was careless and make no excuse. I hope my story serves as a warning and causes everyone to take this seriously."
Based on Doris and
Fans watching a game in Dallas were shocked when the NBA suspended the season. Mark Cuban, the owner, watching from the stands.
Just unbelievable, just not something you ever could have anticipated.
There's any new information that you can share with us about what the league plans to do next? And do you see the NBA season resuming at some point?
I hope it resumes. Nothing really I can share. I mean, other than the league is going to do what's best for the safety of our employees and for the fans and customers. We're going to try to do the right thing.
Cuban says he told the team to self-quarantine just to be safe, but worries about the impact on all the people who work at NBA arenas.
Now that the games are suspended, they're not going to have that income, and so that just wasn't right to me. So we'll compensate them in advance. Even if the games might be played in the future, we'll still compensate them now so they can pay their bills. And we'll do that for arena employees for the Mavs games and for hourly employees that work for the Mavericks that might not get those hours.
The economic impact is already visible in Washington state, where COVID-19 first hit in America.
When you come to Seattle, you come to the Pike Place Market, and on a weekend or during a busy time, you're shoulder to shoulder with people. There's so much room here. One of the things that we heard from a number of the shop owners is that things are quieter, that they've never seen it like this before.
Taking extreme measures now, like cancellations and closures, will help buy more time for a more effective response.
So a colleague of mine was just saying, we should all just be prepared that we're going to get it. Do you think that that's the appropriate attitude?
No, I don't think it's the appropriate attitude. The appropriate attitude is to try and do something about it. To just throw up your hands and say we're not going to do anything about it is not appropriate and not good public health.
For Nightline, I'm Lindsay Davis in New York.